and welcome. My name is Christine and I have Common Variable Immune Deficiency, aka CVID. Today, I would like to talk about vaccines and how they impact somebody who has CVID. I know vaccines have been a controversial subject over the last several years, and it seems like everybody is an expert on them, whether you should get them, whether you shouldn't, whether you should vaccinate your children. Earlier this week, I got my seasonal flu shot, and I figured doing a video on vaccines with CVID would be a good idea. A frequently asked question that I do hear with somebody who has an immune deficiency is if they should continue getting vaccines. Before I get into how vaccines directly impact someone with CVID, I want to go through the different types of vaccines. Before I did research for this video, I thought there were only two types of vaccines, the live and the killed. Well, actually, there are 4 types of vaccines, so I'm going to go through those now. With live vaccines, a weakened form of the virus is used in the vaccine. Examples of live vaccines are the measles, mumps, and rubella vaccine, the MMR, the varicella vaccine, which is the chickenpox vaccine, and the rotavirus vaccine. Then there are killed vaccines, which are the inactivated vaccines. These vaccines are made from a protein or other small piece taken from the virus or bacteria. An example of a killed vaccine is the vaccine for whooping cough, also known as pertussis. Then there are the TOXOID vaccines, which contain a toxin or chemical made by the bacteria or virus. This makes you immune to the harmful effects of the infection instead of the infection itself. Examples of this type of vaccine are the vaccines for diphtheria and tetanus. The last type of vaccine is a biosynthetic vaccine, which contains a man-made substance which is similar to the piece of the virus or bacteria. And an example of this is the hepatitis B vaccine. Now I would like to talk about the advice that I had received from my healthcare team regarding vaccines and my CVID diagnosis. When I was diagnosed with CVID, I was 16 years old. I had pretty much already gotten all of my childhood vaccinations. When I was diagnosed, one of the bigger points that my immunologist and my pediatrician brought to my attention was that live vaccines are contraindicated. At this point, I was due for my chickenpox booster, the varicella vaccine, and I did not get it because now I had this diagnosis of CVID. Although I was advised not to get live vaccines, I was still advised that I was okay getting other vaccines. So for example, I got the meningitis vaccine before I went away to college. I got the entire series of the HPV vaccine, the Gardasil vaccine. I did not have any side effects to that one. I know that is still a very controversial vaccine today. Another time that I had seeked out the advice of my immunologist was regarding the tetanus shot. When I was in PT school, I actually got bitten by one of our dogs while I was trying to break up a fight, which was a really bad idea. But I had to go get stitches in my thumb. When I was at the urgent care, the doctor was really pushing for me to get the tetanus shot. And I remember telling the doctor, I don't think I can get it. I'll email my immunologist in the morning, and if he recommends it, yes, I will go and get it. But I have an immune deficiency, and of course, she didn't really like listening to this. I know in the healthcare field, a lot of times patients do think they know more than the doctors when they don't, but sometimes when you're the person that has a rare illness, you also have the side of not many doctors know what this is that you have. So I'm sure I got labeled as the non-compliant patient, the patient that's being a pain in the butt, but whatever. I emailed my immunologist the next morning and he told me not to get the tetanus vaccine. I also asked my immunologist for his advice when my sister had my first niece, because I know there is some concern with being around family or relatives when they get these live vaccines that are contraindicated for people that have common variable immune deficiency. My immunologist told me not to worry about it with my niece, that there wasn't a period that I had to avoid being around her. It is known that one of the things they do use to diagnose people with CVID is how your body responds to the pneumococcal vaccine. When I was being diagnosed, I had the pneumococcal vaccine and they tested my antibody response to it. I only responded to something like a third or the fourth of the vaccine, which is what confirmed my diagnosis to CVID. So the doctors don't really know the actual response that CVID patients have to various vaccines. From what I have read, it is still recommended to get these vaccines because having a little response is better than having no response, which is what you would have if you did not get the vaccine itself. This is the advice that I had heard and that I had gotten from my own medical team. I looked up and did some research to see if there was any articles regarding this information. In the Journal of Allergy and Clinical Immunology, there was an article published in April of 2014. It is titled Recommendations for Live Viral and Bacterial Vaccines in Immunodeficient Patients and Their Close Contacts. I will link this article in the description so you can read it on your pleasure. I am just going to go through basically what I grasped from this article and how it relates to somebody who has CVID. This is a direct quote from the article. For B-cell primary immunodeficiency, such as X-linked A-gamma-globulinemia and common variable immune deficiency, CVID, vaccines to be avoided include oral poliovirus, yellow fever, live attenuated influenza, and live bacterial, example, typhoid vaccines. The table, which I'll bring up next, mentions the uncertainty of risk of effectiveness of the measles and varicella vaccines for immunodeficient patients because of the lack of specific evidence for protection. Most antibody-deficient patients treated with intravenous immune globulin do not have the capacity to generate protective antibody responses. The article then goes on to say, although proscribed by the Red Book in 2012, there are no reports that patients with CVID who received attenuated live influenza vaccine became infected or spread live virus to others. It is also true that close contacts immunized with the live influenza vaccine rarely, if ever, have transmitted the virus to patients with CVID. The table in this study lists the vaccines that are contraindicated, the effectiveness of some of the vaccines. So for somebody with a B lymphocyte immune deficiency, such as CVID, the absolute vaccine contraindications are smallpox, yellow fever, most live bacterial vaccines. It says in here, consider the measles vaccines, and there is no data for the varicella or rotavirus vaccine. The table then says, the effectiveness of any vaccine is uncertain if it depends only on humoral response. IVIG therapy interferes with measles and possibly varicella immune response. The efficacy of the pneumococcal vaccine is not documented. And then this says, consider measles and varicella vaccines. This article also talks about the recommendations for people that have close contact with patients with a compromised immune system. So your relatives, the people that you live with. This is a direct quote from the article. Close contacts of patients with compromised immunity should not receive live oral poliovirus vaccine because they might shed the virus and infect a patient with compromised immunity. Close contacts can receive other standard vaccines because viral shedding is unlikely, and these pose little risk of infection to a subject with compromised immunity. The article does go on to say, however, mothers at high risk for a child with primary immune deficiency and without an up-to-date immunization history should also receive pneumococcal, Hib, and meningococcal vaccines so that maternally transferred IgG antibodies can protect the potentially immunodeficient newborn child during the first few months of life while definitive diagnosis and treatment are undertaken. And then it goes on to say, killed trivalent influenza vaccine is preferred for close contacts, although live attenuated influenza vaccine can be given to close contacts because of the low rate of transmission to other subjects. This article does confirm, which I know is well known, but it seems to be a lot of people still do not believe this for whatever reason, but this does state killed vaccines will not cause infection in immunodeficient or any other children. Getting the killed cold flu shot will not give you the flu. It is science, it is proven, it is confirmed. If you get the flu after you've had the flu shot, you already had the flu in the first place. It wasn't the result of the flu shot. The article does go on to talk about this, but this bit is my own thoughts. I'm not reading anything directly from the article, but it is, why are vaccines important? Why is it important that people get vaccines? It is because there's something known as herd immunity. Basically what herd immunity is, if the majority of the population has an immunity to a virus, it protects those people that either cannot get the vaccine because of medical reasons or have little response to these vaccines because of something like an immune deficiency. So, for example, let's say we have a town that has a population of 100. Of these 100 people, say there are 2 people in this town that have an immune deficiency, so either the vaccine's contraindicated or they just barely had an immune response to the vaccine because of their immune deficiency. They should be okay in this town because 98 other people that have healthy immune systems got the vaccine and have the protections. So these 98 people will not get whatever the specific virus or bacteria are, and they protect those 2 other people. What we see happening today are there are so many people that are against vaccinations that we are losing this herd immunity protection for these people that cannot get vaccinations. So let's take this town of 100. We have the 2 people that can't get vaccines or have a poor antibody response to vaccines, and say 30 people in this town decide, I'm not getting the vaccine, or I'm not getting the vaccine for my child. Now we're down to 68 people in this town having the protection, which provides a risk for all of these people that did not get vaccinated by choice, or those 2 people that cannot get vaccinated or have a poor response to the vaccine because of their immune system. I know I read on the internet where these people say, well, if herd immunity is a thing, then I'm going to have my kid not be protected and I'm going to rely on the herd for protecting my child. But see, it doesn't work that way, because there are people that cannot get vaccines or don't have the response to vaccines. We already have to take into account that these people don't have protection, but now we have all these other people that don't have protection, and we're putting these people at risk. I know vaccines have been so controversial. People are petrified getting them for their children. By and large, I know the recommendation of physicians and pediatricians is vaccinating your children. Granted, they don't have any contraindications to a vaccination. That is my video on vaccines. I hope I answered questions for somebody out there. I hope this is helpful. That's it for today. Bye!